How does the migraine and headache relief method work? Migraine is a disease of the nervous system. The underlying problem with migraine and headache sufferers is that our nervous system is too sensitive or too jumpy. It reacts to small or normal stimulus with an exaggerated response. There are many factors that contribute to these conditions, which include genetic predispositions, external conditions, and more. These determine a lot the triggers that bring on the migraine or headache. Migraines, more than being a headache, involve multiple brain centers, but the two conditions share some mechanisms when it comes to the pain mechanism, although in the case of migraines, this is much more severe. The main nerve involved in this pain is the trigeminal nerve. This nerve has branches that innervate facial muscles, the temporal mandibular joint, the paranasal sinuses, and teeth. When stimulated, the branches of the trigeminal nerve transmit information back to the brain through the trigeminal nucleus in the brainstem. From here, this message is sent to other parts of the conscious brain that acknowledge the pain and the need for action. But for a migraine sufferer, the threshold for initiating this distress signal is lower than normal, and the amplitude of the warning is abnormally high. Basically, the brain of sufferers is uncalibrated. The brain interprets regular pressure, sound, touch, and light sensations as if they were painful. The migraine and headache relief method, by applying pressure to various points in the head and face, activates the trigeminal nerve and the trigeminal nucleus. This is why the pain first seems to become stronger while performing the method. Then, by use of various top-down and bottom-up processes, it calms the trigeminal nucleus, recalibrating it, as if saying, hey, wait a minute, this is just pressure, not pain. And once the trigeminal nucleus has recalibrated to normal, it will stop overreacting, essentially terminating the sensation of pain. What are these top-down and bottom-up processes? Top-down processes are when the higher parts of the brain, the prefrontal cortex, the anterior cingulate cortex, and the parietal lobe, are used to bring the system back into regulation. Here, we utilize methods and concepts from mindfulness-based stress reduction, neurofeedback, body-oriented psychotherapy, and meditation. Bottom-up processes are processes that utilize the body to achieve this regulation. Here, we utilize various body manipulations and techniques and methods from the world of yoga and manual therapy to bring the nervous system back into regulation. The combination of top-down processes and bottom-up processes also seems to affect another phenomena that comes into play in migraines called cortical spreading depression. What causes the intense headache of migraine, according to the current theory, is that a trigger, either in the brainstem or in the periphery, sets off an abnormal electrical event called a cortical spreading depression. This is a wave of electrical activity that sweeps slowly across the surface of the cortex. A cortical spreading depression first initiates flashing lights or abnormal smells we know as the aura, followed by an intense headache. The electrical depolarization results in a release of neurotransmitters and other molecules that cause secondary inflammation. A person then experiences light sensitivity, nausea, foggy thinking, and fatigue for hours that we know as the recovery phase. The integral approach of the method, which combines multiple senses, factors, and manipulations, addresses the brain as a whole, and while further research involving fMRIs and other methodologies is necessary, we are speculating that it is this combination which alleviates the effects of the cortical spreading depression. Now, there are two more factors that are involved in migraines which the method addresses. The first is the vagus nerve. Sometimes called the information highway of the body, it controls many internal functions and brings the brain information about the condition of the internal organs. Though it is not clear why, we now know that the vagus nerve interacts with the trigeminal nucleus and can help it to downregulate the pain. This is how VNS, vagus nerve stimulation machines, are used to alleviate migraines. But while these machines can only trigger the entire vagus nerve, through the migraine and headache relief method, we can selectively activate parts of this nerve, focusing on its pain-deregulating aspects. In addition, the method works on some of the digestion issues affected by the vagus nerve that are involved in migraines. Finally, it is believed that migraines are also connected to a chronically active sympathetic nervous system. The sympathetic branch of the nervous system is the part of our nervous system designed to keep us alert in stressful situations. It is sometimes called the fight or flight mechanism. Basically, it is activated when we are stressed or in danger. A chronic activation of this branch leads to this part of our system becoming depleted, and when it is depleted, it contributes to the imbalance that leads to the migrainous condition. The migraine and headache relief method utilizes various body hacks, mainly from the world of yoga, to activate the parasympathetic nervous system known as the rest and digest system. This is the complementary aspect of the sympathetic nervous system, allowing it to regenerate and easing the effects of its depletion. In this way, the migraine and headache relief method addresses multiple aspects at once to bring a complete and fast recovery from migraines and headaches.